Yeah, thanks for having me today. I remember that back in med school, my professors told me that people are usually afraid of cancer. However, they end up dying from cardiovascular diseases. It is not a secret that cardiovascular problems is still a number one killer in the world. Every year we get millions of new cases that cost our economies billions of euros. However, many of these diseases can be prevented with timely diagnosis, and the first method of choice here is the heart ultrasound imaging. Now, notice how this doctor is holding a tiny little probe in her hand and then places that probe on a chest of her patient and gets these two-dimensional moving images on a display of an ultrasound machine. At the same time, she's working a lot of that keyboard to perform all of the measurements manually. And in fact, this procedure takes a lot of time. It takes from 30 to 90 minutes to complete, and it's basically mostly manual work. Moreover, a physician must be a very skilled one, had a lot of expertise in the field. And the bottleneck is that patients are forced to wait for 5 weeks in order to get admitted to a hospital for this examination. Now, our solution is quite simple. We're using a deep learning neural network that is capable of recognizing different standard heart ultrasound image views and then perform all of these measurements without human input. So basically, instead of having to do the examination for 30 minutes of all the manual measurements, you can now do it in 5 minutes by skipping the measurements. We're integrating our solution into picture archiving communicating systems. Those are basically large platforms where hospitals use them to store their medical data, medical images, to open whatever they want and to share them. We sell our solution to hospitals, however, end users are the cardiologists. We sign a 3-year contract, charge for installation, and a support fee. What sets us apart from our competitors is that we're focusing on the full heart ultrasound examination protocol, whereas our competitors, they're doing only fractions of it. The traction up to this point is, well, we are actually a very recent company. We just launched last year. However, we have already secured our pre-seed funding round of 360,000 euros, and we're moving forward with installations in various different hospitals. At the same time, we're doing the regulatory approval to obtain the first CE mark of our software, and we're integrating in more and more PACS developers, for example, Arteries and GE Healthcare. We plan to launch into the market next year around April or May. Meet our team members. What is unique about our team is that we're comprised of medical doctors and people who have also had previous experience in deep learning projects. And that makes us, guys who know exact pain points in the healthcare system and how to tackle them with AI. So thank you very much for your attention, and I'd be happy to answer your questions.
You said you start next April. It means that you start to sell your product, and now you have just pilots, or what?
Yes, the product is undergoing this regulatory approval, so you cannot sell medical device without the approval. So as soon as this approval is done, it's okay to go. We're launching into the market at the same time.
Okay.
Is there any indication that some of the trials will convert into sales?
Yes, that is actually in the Netherlands. There are 2 hospitals, and we're looking forward to working with them more because they actually have the need of such solution because the workflow of their cardiology clinic fits our business model.
Hi, this is Danny. Sorry, I missed the intro earlier. How did you arrive at the price of your solution? Is it benchmarked? And if not, how did you arrive at that price?
Yeah, it's basically a benchmark. Well, we looked how much actual objective value we create for a hospital. So we saw that if you make around 16 patients a day without AI, and you can have, the procedure made in 5 minutes, it means 6 times faster. However, you have a patient cap because patients are waiting for 5 weeks, so you cannot admit 6 times more. You will most likely admit 5 times more. And then we just calculated the difference, and then we just take a fraction of the objective value we create.
What are your competitors charging? Do you know that?
With the competitors, it's very tricky because almost none of the competitors have a regulatory approved device, and they only have a very small fraction of the measurements done. And some of them only sell their algorithms, their software, to larger players like GE Healthcare, so they don't go into hospitals.
Do you, sorry, you providing hardware and the software?
We provide software only.
Oh, okay. Okay.
Are you regulatory approved by this point?
No, as I've told before, we're running the regulatory approval, and it is expected to be granted by TU Ireland in Germany in April or May next year.
Have you started with FDA?
Yes, the FDA process is quite simple. We'll be launching the solution with 510K pathway. So there are already some devices on the market, but after some time, we'll add on more functionality and we'll be doing the full FDA approval for de novo application.
Are there any use cases and feedback from real doctors or hospitals that you have?
Currently, we have installations in one hospital in Australia, several hospitals in Lithuania, and we plan to install those other hospitals in the Netherlands. The solution is not at very large scale right now, but it is expanding because we had to pay a lot of time for integration itself. So we expect to have the first feedback in a couple of weeks.
A question regarding your trials, so to speak. They seem to be a bit scattered from a geographic perspective. And what was wondering, what's the focus on once you roll out and launch? Do you have a geographic area, and with how many potential hospitals are you in discussion? As in my experience, it can take quite a while to get it tested and get the trust from the different stakeholders.
Yes, historically it was like this. We had our first partner in Singapore that had a hospital who wanted, the solution like this in Australia. So we started there. However, since we have better connections in Europe, then we're starting to launch, clinical trials in the Netherlands, Latvia, Lithuania, because we're more connected to there. From the perspective, of sales and going into business, I mean, Europe is the go-to market because especially Western Europe has a better workflow suited for our solution. Therefore, we plan to stick with it.